Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, we're going to be talking about a hot button topic in dentistry, which is patients who refuse x-rays. Now, I want to start out by saying that yes, it is a patient's right to do what they want with their body. So it is, but we got to know how to handle it. So here's what to do. So patients who refuse x-rays. Now, typically, while this isn't always the case, this is the case in offices where there was an old school dentist, maybe somebody who was trained in the 1960s or 70s. And back then standards weren't really, well, maybe followed, and they wanted to be mavericks. And so they do what they want and they let patients do whatever they want. Unfortunately, that's not really helpful in this day and age. In fact, it could be a real problem. So, the question in some forums became, hey, so why don't we give a patient a refusal form? Well, you can, and they can sign it, but it is not really permissible, or I'm not even sure how legal it is, to have a patient sign a form which tells them that they are agreeing, or basically tells you that they are agreeing to substandard treatment, because that is below the practice standards. Not getting x-rays, not getting the proper diagnostic information. You can't make them agree to practice underneath the standards of care. And that's what you're doing when you're trying to give them that form. That's never going to hold up in court. No matter how much you think it's going to, or think it's going to protect you, it will never hold up in court. Let me repeat that. It will never hold up in court. I keep seeing people asking over and over again, and it's like, no, it's not going to work. So stop trying to make them sign the form. What you do is you've got to be, well, it's also called, supervised neglect. So it's a big problem. That's just like cleaning, doing just a cleaning instead of doing scaling root planing. That's the same thing. So what to do? You give them their information, that is that they have a certain, for example, for the just a cleaning, it's periodontal disease, and you give them the treatment options. In this case, you've got to be kind but firm. It's bad to be mean, but you have to be kind but firm. Firm is important because it's kind of like an ultimatum to a certain degree. I mean, you are trying to do your best job for the patient, but they're not letting you. And that's kind of how you have to frame it. They're not letting you. It's like asking, for example, a carpenter to cut a piece of wood to a specific length, but not use a ruler. That's one way to put it. Another way that I tend to talk with patients and let them know is, I ask them, well, how does a physician know if you have diabetes? Can they look at you and tell that you have diabetes? I mean, maybe sometimes there's a certain smell to some, and then which is specific to certain diabetics because of ketoacidosis and breakdown products and things like that. But really, as you look at somebody who doesn't have that kind of a sign, can anybody tell if somebody's a diabetic just by physically looking? The answer is no. So can we tell if there's decay, periodontal disease, maybe even tumors or other problems just by looking with our eyes and instruments? The answer is no. We're not going to pick up on everything, and they're not letting us. I had a patient at one point here at this practice. He refused x-rays for 21 years. His refusal could legally drink. And I basically at that point just told him, and I wasn't maybe in the gentle but firm. I said, look, you get x-rays next time or you're done. You go somewhere else. Because, your refusal can legally drink. He said something along the lines of, oh, I'm a stubborn Dutchman. And he can be a stubborn Dutchman at another practice then, because I'm not going to take that. So that said, that one, again, that was 21 years. That's a little bit different story. If it's 2 or 3 years, again, kind but firm. Say, look, I can't diagnose properly without the information. And if we can't get x-rays on you, I will not be able to treat you. About 95% plus of the time, patients will then change their tune and will agree to x-rays, and that way you can diagnose things, which I have found, interproximally have certainly found decay, that changes the clinical picture. So that said, don't let patients drive you. And if you're in a practice, you're acquiring a practice with an old school dentist that is retiring and frittering away and walking off to the sunset, make sure that you slowly turn the ship around and change the culture, because culture of permissivity as it was before is not a good thing. And patients might say, oh, I'm not gonna sue you or stuff like that, and then they'll turn around and do it. I've seen it happen. While unfortunately it hasn't happened here, I'm trying to protect against that. So don't give the opportunity. Make sure you're doing the right diagnostic thing. And if patients don't want that, they can seek out the help of another provider, because that's really what it comes down to. You want to make sure you're doing the right thing for your patients. And if you can't see properly, if you can't diagnose properly, it's all on your license. So make sure you get what you need. All right. Thank you so much for joining me, and I hope you're all staying well and healthy.